My name is Tim Maria, host of Digital Health Live here in super cool San Francisco. I got the last interview of the day. Digital Health Summer Summit's been going on. Dr. Jordan Shlain, founder and chairman of Healthloop, is my guest today. How are you doing?
I'm doing well. Thanks for having me again.
So we caught up, I think it was at CES last year, and that is
2 years ago.
Is it 2 years ago?
2 years ago.
Wow, time flies. So like 150, there's a lot of people at that event. And today's a really cool experience because it's a smaller group. And so what brings you out this time?
I'm just trying to preach to the people out there that will listen that digital health is an interesting space, but it doesn't, you have to remember that it involves people. Healthcare is a people business in need of data and apps, not an apps and data business in need of people. Yeah. And people basically want to be listened to. The human operating system is analog, and we want our analog system to be more efficient, and we want more meaningful relationships. So I'm here talking about the doctor-patient relationship and how if you think you can get around doctors and you can kind of get the doctors out of the room by developing an app, it ain't going to happen. Yeah. And I also don't believe that more is better. I think better is better. And I think a lot of these apps and a lot of these things that people are trying to build are giving doctors more information without a lot of the substantive context and nuance, which creates more work. Yeah. So more yields more, and then you start crushing, time is killed, and there's only, there's no time machine yet, right?
They're working on that.
Yeah, I've got a little lab, but.
So, how do you make the jump from doctor to entrepreneur?
It's called innovation by irritation, and I know what my patients need. I know what I need, and there's nothing that gets both of us what we need. Yeah. And so I just decided to build something that would attempt to solve the problem of bridging the gap between the doctor and the patient. Every dollar that's been spent in the history of medicine on research, on textbooks, on medical education has been on how to diagnose and how to treat. That's where we've focused. But guess what? Once I tell you your diagnosis and once I tell you the treatment plan, that's when the movie starts. And it's called Your Healthcare Movie, and you're the main actor, and we don't know. You have no clue what happens after that. And I typically don't have a clue what happens after that unless I'm somehow connected to you throughout your journey. So I built the Healthloop, which is the kind of the digital connective tissue using empathy and nuance to stay connected with you on your journey. And so I'm your co-star. You want your doctor to be the co-star of your movie, right? I
just had an interesting experience, and it's like, oh yeah, here, take this pill and call me in 3 years. Really?
Yeah, and that's really the last mile of medicine, and that's where the whole healthcare system falls short, is because nobody's really cared about, and then what? Diagnosis, treatment, and then what? Well, historically, no news is good news, but the truth is no news is no news. Yeah. And guess what? To infer that it's good news is a major fallacy.
So, when I say Healthloop, what is the experience?
So basically, when I give you your diagnosis and your treatment, and I basically take a prescription pad out and I say, hey, check your email. And you say, hey, doc, I checked my email. I say, yeah, but this email is a prescription. And so you'll get an email that says, Dr. Shlain wants to check in with you. Well, first of all, I say, well, do you want the best outcome with this new diagnosis? And you'll say, yeah, I want the best outcome. I say, okay. If you want the best outcome, you need to play an active role in that good outcome. You're the starring actor. I'm just the co-star. You're the protagonist. And so you get this check-in, and it says, hey, Dr. Shlain wants to check in with you. You hit the check-in button, takes you to the HIPAA, blah, 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 security. And it says, hey, your post-op hip replacement day number 5. You probably haven't been thinking about it, but most people think about these types of things, and those are wrong ways to think about it. Don't do this today. And by the way, you should do this today. In fact, you must do this today. And, by the way, answer a couple questions about how you're doing today. And depending on how you answer those questions, you may not know that, oh, by the way, I feel like I got a cramp in my calf. We ask you, do you have any cramps in your calf? Yes, I do. Well, you thought that was a cramp because you just had surgery and you're kind of coming off drugs. Well, that's a blood clot. That's a DVT. That's a deep vein thrombosis that you didn't know. And by the way, by the time you would have surfaced that, you're in an ER with a lung blood clot. You're a pulmonary embolus, and then you may die. And that happens like frequently. I mean, like 4% of surgical patients have that happen. But by the time they know, it's an ER visit. And with Healthloop, as soon as you say you have a calf pain, then it comes back to me, and I think I can show you. I don't know. Let me just. So then, me, the doctor, I get something that looks like this every day. So EMRs and PHRs, they basically are. They end in the letter R, which stands for record. So they tell you what happened. They don't tell you what's happening. So if you look at this, basically what you can see is I have a summary of all the patients that I'm following. So while I was up on stage, I saw 19 patients. I had 19 e-visits, and it repeated back to me. 17 of them are fine. One of them is wobbling, and one of them went into the ditch. One of them tripped a wire. So I now can click on this, go in, and communicate with my patient or call them directly, and I can get all the context and all the nuance on how far they are after treatment, why they tripped the wire, any other context. I can make decisions right now, and I don't have to call them. Now, if I want to call them, I can. The app will let me call them. But I can leave an audio message. I can say, you need to go to the office. You need to go get a... So right now in Healthloop, for example, if someone has calf pain, in surgery, they just send them directly to the ultrasound. So no ER. Go to the ultrasound's positive, then go to the pharmacy, get your medication, go home. So this basically, so what I was saying up on stage is data has a waiting room, just like people have a waiting room, and I call that the waitabase. So data just sits in a waitabase until a human catches it, right? And so we need to lubricate the data so it doesn't sit in a waitabase. And so with Healthloop, we speed data through the system so actions can be taken, and all in the spirit of the best outcome for the patient. Like, we all want the best outcome, but data gets stuck in these waidabases, and by the time someone finds it, the wheels came off.
You've got this big long word wrong with you. I can tell you a little bit, but have fun.
So we need to lubricate data to flow faster, and we need to attach a data to actions. And in fact, I will come up with a new thesis pretty soon, and a new term that's not used in the word of the data yet, and I call it theta data. So expect to hear more about thetalytics, because I'm going to coin a new term and come up with a new field. And theta data is really actionable data. So data that's wrapped in context and nuance is actionable, and then that actionable data is called theta data. And
soon. So that's Dr. Jordan Shlain. I want to thank you for your time. I want to thank Brian Rauschenbaumer, who's doing our camera and production today, Jill Gilbert, and the whole Digital Health Live staff. But thanks a lot. We love having you. So we'll learn about theta data next round.
Thetalytics, man.
Thetalytics.
The next big thing.
You heard it here first.
You heard it here first.